It's a dramatic step, the most extensive crackdown in the country. A 4-month ban on all sales of vaping products in Massachusetts. Governor Charlie Baker said yesterday the move is necessary to give public health officials time to investigate a growing health crisis, with at least 9 deaths blamed on vaping across the country and hundreds of vaping-related lung injuries reported, including more than 60 in Massachusetts alone. But the news of the ban came as a shock to many local businesses who sell the products.
It looks like we're gonna be potentially laying a bunch of people off, which is really unfortunate, and looking for another career.
Others have also raised concerns the vaping ban may do more harm than good. I'm joined now by Health and Human Services Secretary Marylou Sudders. Secretary, it's good to see you. Thanks for being here. By the way, I invited you here to talk about the vaping thing, but before, you know Paul, who was in this package. You do?
Yes, I've had the pleasure of meeting with him and talking to him about his recovery.
Can I just say briefly about this? Is it, I guess it's obvious, only the feds can change this rule that would make it easier to prescribe?
Yes, unfortunately, it's a federal rule and only the feds can change it, and we are very supportive of the feds eliminating the waiver of doctors.
How about changing the doctor's behavior? I mean, you've gotten involved in some of those things in terms of how many opioids can be in a prescription. Is there anything the administration, the state can do to get rid of this, in my opinion, obscene hesitancy on the part of some doctors to treat those with an addiction issue?
So we've done a number of things in Massachusetts, and let me just mention a few. So one is we brought together all the medical schools about 3.5 years ago and asked them to actually change their medical curriculum to ensure that all doctors who are graduating from Massachusetts medical schools have some basic understanding of addiction treatment, because we were being told people were graduating without a fundamental understanding of addiction treatment. And this year was the first class of graduates from medical schools in Massachusetts, doctors who have some understanding. That's one. 2, the Mass Medical Society now provides free training for doctors to help them increase their comfort around diagnosing, evaluating, and treating individuals who are patients on their caseload.
So you think we're on the cusp of a change in attitude?
Yes, I do.
Let's move to vaping.
But before, can I give you one other statistic?
Because
I know you like data.
I do.
So in January of 2015, when we came into office, there were just over 1,000 doctors who were prescribing Suboxone. We now have just under 5,000.
Oh, really?
We're better place than we were, but we still have a long ways to go.
It's important data. Growing consensus, I think, across the board that flavored vaping products should be banned. But your boss has implemented the most far-reaching in the country. I assume the other 49 governors know as much as Charlie Baker does. Why is he going where he's going, where nobody else has chosen to tread, for lack of a better expression? Seriously.
Well, only a few states have actually implemented partial bans. I mean, I think Rhode Island made an announcement today, New York and Michigan. And as we've been...
That's around flavored stuff, though.
That's,
is it
it's
not
just, right,
Michigan,
it's a partial. Right? It's only, we would consider a partial ban. As we've been sort of watching the number of cases that have been being reported to the CDC, we've been sort of quietly studying what's been going on. And when we brought together a group of pulmonologists, it's pretty clear to us that no one really understands what the root cause is of vaping-related pulmonary disease, which is why we felt it was important to have a temporary ban put in place.
And I assume the 4 months is randomly chosen. If you need more, you'll ask for more or demand more, or if you need less, you'll act before that. Is that the safe
yes,
assumption?
so
Okay.
4 months is it's a pause. We also understand that it has an impact on businesses.
Yeah, I want to get to the businesses in a minute. The reality is, I assume people, you and the governor, think we need federal action, because it seems to me, just like you can go to New Hampshire and buy an assault weapon, which you can here, you can go to New Hampshire and buy that which is now banned on the vaping front across the border and just bring it back to Massachusetts, right?
Right. There's no question we need federal action on regulating vaping products.
So maybe you can, the President of the United States earlier this month spoke on vaping. Here's Donald Trump.
We can't allow people to get sick, and we can't have our youth be so affected. People are dying with vaping, so we're looking at it very closely.
Saying all the right things. So why is the FDA dragging its feet? I mean, what are they waiting for?
The FDA has proposed rules out, and we're waiting for them to to regulate them as soon as possible.
I mentioned at the beginning of this thing that you've taken some criticism in the last 24 hours for the move that you and the governor made here. There are at least two that I've identified, maybe three. Let's start with one that came from one of the members of the Cannabis Control Commission. Shaleen title was on Morning Edition right here on GBH this morning with Joe Matthew. Here's what she had to say.
The most relevant question is there any evidence that's linking the illnesses with legal regulated products? And I think the answer is no. When we issue a ban, especially on an addictive product like e-cigarettes, we are pushing people to the illicit market, which is exactly the source of the unregulated and potentially dangerous products. I think that actually goes against the principles of public health and harm reduction.
Does it go against those principles?
No, because no one knows what the root cause is of severe pulmonary disease that's vaping related, which is why we believe we need a pause in order to understand root causes in order for whatever we're going to do going forward actually addresses the issue.
But she is right about the black market. I mean, all I read almost every single day is this mountains of illegal vaping products coming out of China, for example. Right. And so why won't people kids aren't supposed to use them, and they're using them in huge numbers, as you know far better than I, since you like data too, by the way. Why isn't she right that they're just going to move? They're not all of a sudden going to give up the demand, are they?
So first of all, it's a temporary ban. This is a temporary ban. The black market existed before and after this ban is over, and our whole point is to bring awareness around the danger of vaping and to understand what is the cause of vaping. Is it the black market? Is it marijuana products? Is it e-cigarettes?
Would title's criticism concern you more if it was a permanent ban that was in effect?
No. I think what we need to do is understand what the root cause is and then develop the regulatory and statutory framework going forward.
Okay, second criticism, I may fall into this camp, I have to think about it more, the anti-cigarette types, and I am just out of my mind anti-cigarettes. The facts are, I don't know what the data is here, but the facts are, I've spoken to a ton of people who say, this is what helped me get off cigarettes. Cigarettes are far more deadly, that we know, and we do know the cause and effect, than vaping is. So what do you say to people who've used vaping or hope to use vaping to get off cigarettes?
So the FDA has not indicated that e-cigarettes is successful at helping people actually get off cigarettes, but they're both dangerous. Cigarettes are actually labeled, right? We know when you buy cigarettes, there's a label on it telling you it's dangerous for your health. There's nothing that's a label on vaping products.
But cigarettes are killing thousands and thousands of people. Vaping is killing, I'm not excusing it, in single-digit numbers of people.
At this point, but we also know it was underreported and was only starting to be reported to the CDC come spring. Vaping's been around for a long time, but people weren't asking. We might ask you, do you smoke cigarettes when you go for your annual physical exam? We'll ask you, are you drinking, right? We'll ask you if you wear your seatbelts. Did your doctor ever ask you, were you vaping? Now it's on the attention of our medical professionals and asking people, are you vaping?
Just a couple of more quick things. We were contacted by a lawyer this afternoon for something called Vapor Zone in Danvers that said they plan to file suit against the Baker administration tomorrow, arguing you exceeded your power, both in declaring an emergency and those sort of things. How do you plead?
Not guilty, because the governor has actually broad authority in the Commonwealth to declare a public health emergency. And as you know, we do things deliberately in this state. This governor does not make rash decisions at all. We brought together medical experts who said this is an emergent public health issue. We need to deal with it.
Secretary, one last quick thing. CEO of Juul stepped down. They've announced the end of their lobbying, a lot of their advertising. Are they basically waving the flag? Is this the end of the industry? I mean, are we seeing it step by step by step?
Well, they also announced today that they have ceased online sale to Massachusetts. I do think, obviously, the vaping industry has been taken to task. I do believe we need federal regulations to label what these products are to ensure the public safety and the public health of the Commonwealth.
Marylou Sudders, thanks so much. It's good to see you.
Thank you so very much.
Appreciate your time.